Welcome to this episode. Today we're diving into a foundational concept for the next generation NCLEX exam, the Clinical Judgment Measurement Model, or CJMM, and specifically the very first step, recognize cues.
Yeah, it's such a critical skill, Liam. Recognize cues isn't just about spotting abnormal data. It's about discerning which client findings truly matter for patient safety and care priorities. Missing those cues can lead to what we call failure to rescue, which is a major concern in clinical practice.
Exactly. And the NGN exam really tests this skill by presenting realistic clinical scenarios that mimic actual medical records. Candidates have to sift through a lot of data and figure out what's relevant. So let's start by briefly outlining the 6 cognitive skills in the CJMM. They are: recognize cues, analyze cues, prioritize hypotheses, generate solutions, take actions, and evaluate outcomes.
Right, and recognize cues is the gateway skill. If you don't get this right, the rest of the clinical judgment process can fall apart. It's like trying to build a house on a shaky foundation.
That's a good analogy. And the NGN test items are designed to measure this by giving unfolding case studies. So you get a clinical scenario with health history, admitting problems, current medications, vital signs, all presented as part of a medical record. The challenge is to identify which findings are relevant to the client's current condition and care priorities.
And that's where the nuance comes in. Not every abnormal value is relevant. Some findings might be expected for the client's age or situation. So recognizing relevant cues requires keen observation and clinical reasoning to separate the signal from the noise.
Yeah, the signal versus noise analogy really fits here. You have to filter out the background data that doesn't impact immediate care decisions and focus on what truly matters.
Let's talk about the example from the document. The 91-year-old client brought to the ED after a fall. The nurse documents a bunch of findings. Temperature 96.8 degrees Fahrenheit. Heart rate 90. Respiratory rate 22. Blood pressure 142/88. Oxygen saturation 92% on room air. Alert and oriented ×2. Pain rated 10 out of 10. Whimpering and holding the right hip. Right leg externally rotated and shorter than the left.
Right, so at first glance, many of these are abnormal. But the key is deciding which are relevant. For instance, the low temperature of 96.8 is actually expected in older adults due to physiologic changes with aging, so it's not really relevant here.
Exactly. And the client being alert and oriented ×2, meaning oriented to person and place but not time, might seem concerning, but given the trauma and severe pain, it's not immediately alarming. It's a mild deficit that's understandable in context.
The elevated blood pressure is interesting too. It's above the normal range, but it's likely a sympathetic nervous system response to severe pain. So it's not a priority cue in this situation.
Same with the slightly elevated respiratory rate and the oxygen saturation of 92%. Both could be age-related or pain-related changes, so they're probably not immediately relevant.
So what are the truly relevant cues here? The severe pain rated 10 out of 10, the client whimpering and holding the right hip, the right leg and foot externally rotated, and the right leg being shorter than the left. These all point to trauma, likely a hip fracture, and require immediate attention.
This really highlights how recognizing cues isn't just about spotting abnormalities, but understanding their clinical significance in context. It's a sophisticated judgment skill.
And it's important to note that at this stage, recognize cues, the nurse's task is to identify relevant data, not to interpret or analyze causes. So you recognize the cues indicating trauma, but don't yet diagnose or plan interventions.
That boundary between recognizing and analyzing is crucial. Jumping to conclusions too early can lead to errors. The NGN exam tests this cognitive boundary explicitly.
So for NGN preparation in clinical practice, mastering recognized cues means focusing on the clinical context, baseline patient characteristics, and expected physiologic changes. It's about filtering out the noise and zeroing in on the signals that matter.
Yeah, and practicing with unfolding case studies helps develop this skill. It's like clinical triage. You're constantly sorting through information to prioritize what needs immediate attention.
And ultimately, this skill improves patient safety by enabling timely identification of deterioration or major changes in condition, preventing failure to rescue.
So to sum up, recognize cues is a nuanced, context-dependent skill that's essential for safe, effective nursing care. The NGN's focus on this step reflects real-world clinical demands.
Absolutely. And in future episodes, we'll build on this foundation by exploring the next steps in the clinical judgment measurement model.
Thanks for joining us today. Hopefully this gives you a deeper understanding of recognized cues and how to approach it both in practice and on the NGN.
Take care, and we'll catch you next time.